Good evening. It's the weekend, so I have time for another data update. And I opened up my paper this morning and I saw something that I want to talk about in part one. The other two topics have been sort of brewing for a little while as well. But this is something that was really instigated by opening up the paper and seeing this. Experts warn that COVID-19 deaths could more than double by year's end. This is strange to me because the epidemic started back in March. And so we've had more than 6 months that we've been going to, or exactly 6 months right now. And then we have 4 months left in the year. I actually don't expect the epidemic to speed up given what we know. And I'm going to have some more about the reasons why, the medical advances that we've made in a later part. There's no reason for me to be certain about this, but I want to be certain in my uncertainty. And I want to say more than double seems like an acceleration that I would like to see evidence for before we just say this is what the model predicts is going to happen. So the prediction comes from the IHME, the Institute for Health Metrics and Evaluation, and this is actually a model that I followed early on. But then I found that it was more inaccurate than I wanted from a model, and I switched to another model. And I want to explain why I switched models, and so I'm going to get into that. So this old model that I used to follow, but now don't, says that 410,000 people will die by the end of the year. 180,000 people have died to this point so far. Their best case scenario is another 100K plus deaths. That feels too pessimistic to me as someone who's been looking and comparing models, and especially seeing, I don't make the models myself, but I keep track of them. And I have kept track of these models, including the IHME models, since March of this year. And so I want to explain why I've sort of soured on the IHME model. So note this part of the entire article, that they have this kind of caveat in it. Most models don't project further than 4 to 6 weeks ahead, because we don't know with a new virus exactly what it will do. And they have a quote from another modeler who says, it's all conjecture and guesswork because there are so many factors. Now, don't get me wrong, most people expect transmission to increase in the winter. But I don't see how that one part of the factor increasing leads to a more than doubling of what has already happened. I don't know any more than they do, but I want to point out that I want that to be the front page news, that we don't know. The IHME head, Murray, defended the longer range predictions, saying they are intended to help government leaders and the public make decisions. That is great. We need to have science informing our decisions. But if science goes too far out on a limb, it's no longer science. It's emotions dressed up in data lines, okay? It's projections that you're just drawing on the paper because you don't have a mechanism to say exactly why that will happen, and the mechanism is not objective. It's based on subjective. Respiratory diseases always get worse in the winter. That's not in doubt, but we don't know how much worse this is going to get. I want to point out that this aim is political, not scientific in nature, and that's necessary. It's necessary to have an overlap between the political and the scientific. But when you see something like this, a scientist saying, I didn't do this to understand how the disease works, I did this to help people make decisions. You've moved from science to technology, and you've moved to a part of technology that's adjacent to politics. And so I want to be very careful as a scientist. I think we should be more skeptical when we're looking at a new situation like this that has such big impacts. Again, that's a matter of taste. And so I defend Murray's right to put this out here. I just question whether it should be front page news. And what we should have as front page news should be more the uncertainty and looking at all the models. And so, like I said, I've been looking and watching. I don't model these things myself, but I watch the models and I try to see which ones have had the best track record over time. And IHME, I started out watching it very closely, and then I stopped watching it. In fact, I want to go back. I've been doing a lot of these data updates now, and this is an exact data update. You can go back and watch it and see what things look like. In fact, I think that we should do more of that. We should have more of the history of how did things look, how far have we come. And that's maybe one of the themes that I have today in all of my data updates. So let's turn on our time machine, let's step into our TARDIS, and let's go back to this exact slide that I showed you on March 31st. I'm going to recap it so you don't have to go back and watch that whole thing again, because who has time for that? But there was this in the newspaper, March 27th, 2020. The UW model says that deaths are starting to increase less, okay? But it still projected 1,400 coronavirus deaths by July 1st. This is the IHME model predictions as of the end of March. The actual number, when we go back and add it up, was 1,300 rather than 1,400. So this was a little pessimistic, but honestly, as a model system goes, predicting the deaths was pretty much spot on. But it's just getting one number right. Did they get the shape of the curve right? And this is where things start to fall apart. I noticed this as we were tracing this. I was tracing this back and forth, and here's, I'm sorry for the sloppiness of this, but I sort of had to do this quickly, and I had to pull this from the site that I like to use for this that I've shown lately. So I figured consistency was better than aesthetics in this particular case. And so we can go back and forth, and we can roughly plug these on. The data actually comes from two slightly different sources, so if you look early on, it doesn't match very well. But I've scaled it so that you can look at the middle rather than early on. And look what happens. You see that we never reached that 27.3 deaths a day that IHME was predicting. On the other hand, on the tail end, the deaths per day stayed up more than they were predicting. This is something that people noticed about this curve very early on. We were always expecting a curve that would have a fat tail at the end. In other words, it would go up quickly and it would be slower coming down. This curve is a perfect bell-shaped curve because IHME forced it to be a bell shape, despite the fact that we expected it not to be a bell shape. This was my first sign when I saw this. And I'm like, I expected it to tail off more than that, and it turns out that it did tail off more than that. Because it tailed off more, they didn't get the rise completely right. They didn't get the fall completely right, but they happened to get July 1st pretty much right because those two things sort of canceled each other out. So that's how that works. And if you look at the data, you can see exactly how that works in the noisy and late reporting data. Remember, the mortality data takes a lot of time to certify and to get through the system. So often you're looking at something that's a week or more old in many cases. Here is pulled from their exact site, and you see that this was pulled on the same day, and I kept tracking day by day the data, and my impression was that we were below their median line, and we were sort of within their lower uncertainty line. And I was following that, and if I place those on top of each other, you can see that's pretty much what the data ended up doing. It ended up going through that red range at the bottom, about halfway down the red range. So that means that their model was a little over pessimistic, especially when it comes to the peak of the epidemic. It was optimistic, actually, when it came to how it fell down, but that's because they forced it to be a bell when it wasn't a bell. So here's where we stand now. This is the daily deaths from the Tableau page, and I've shown that many times before. It's where I go all the time when I want to see not just what's happening with deaths and cases, but most important, what's happening state by state with hospitalizations. And you can see this is what it has for Washington state deaths. And so you see that we've had sort of a second wave. The second wave has had more cases, fewer hospitalizations, and much fewer deaths, about half the deaths. And you see that the data is noisy. It's not a pretty bell shape, but it does follow this sort of trend that we talked about. The other piece of good news, it's coming back down now. And all three indicators, positive cases, daily deaths, and hospitalized patients, are all coming down. You can see it on that public.tableau page. This is another slide from March. You can look at, if you look at the x-axis, you can see it only goes up through March. And there I was worried. Snohomish County hospitalized were going up, but my point here was that it's going up at a slower rate than it was in mid-March. And I was saying I hope this maintains and starts to come down. And yes, it was very stubborn, but it eventually did. That was about the peak of it right there, and it started to come down there. IHME also makes hospital projections. This were their hospital projections on March 27th. You can see that's where the uncertainties start to spread out on the purple hospital line. And notice that the top line, the top purple line, is hospital bed capacity in Washington state. Because there was uncertainty, we didn't know if all the hospital beds would fill up. And so we canceled elective surgeries. We said, don't come to the hospital for anything but COVID. We want to be ready for it. We were ready for it, and the hospitals had more than enough capacity in the end analysis. Where did the hospital line come in? Well, it came in even below the lower bound of the IHME uncertainty. You can see it's hard for me to squeeze it in there. Let me go back and forth. The purple line is what actually happened, scaled on statewide level to this. Hospitalized statewide data was only reported starting April 1st, by the way. So that happened pretty quickly after this, but it wasn't even being reported when these predictions were being made. That is well within capacity. In fact, I would argue from a management perspective, it looks like we had too much hospital capacity because there are other things that needed to use the hospitals, other patients that didn't use the hospitals. How much harm did we do by excluding those patients? Now, we didn't know. I don't fault people for making that decision. I supported it at the time as well. But looking back, we've got to see that the hospitalization did not turn out even 1/4 as bad as our average prediction from IHME. This is what the currently hospitalized numbers for Washington State look like right now, and you can see, like I said, started reporting in April at about the peak, about 700 people in the hospital. It actually bounced down, and recently over the summer it has bounced up again, but you see that over the last couple of weeks there's a clear and distinct trend down, and we are now down to about 300 people in the hospital statewide for COVID. Well within what the hospitalization system can handle. And I recommend that as the best way to assess how are we doing. There's problems with it. If an epidemic happens, the hospitals could be overwhelmed like they were in New York. But the thing is, New York is the only place where hospitals were truly overwhelmed. Remember that the 4 big states were almost overwhelmed recently. But then it turned around, and those 4 states had very different policies, and those trends have continued. Those outbreaks are essentially over. So looking back at that late March thing that you can look up and see for yourself on YouTube, IHME got one thing right. They got total number of deaths through July 1. The rise they got wrong, the drop they got wrong. And the hospitalizations they got really wrong, to the extent that the advice that they gave was not very helpful. So you can see why when they say we're going to have a huge number of extra deaths, that's about double what other people are saying that we're going to have through the end of the year, I'm going to side with the other people. And I'm frustrated a little bit that the IHME, they tend to focus on press releases, science by press release. And they tend to focus on getting their story out to the reporters. And they are disproportionately represented. So I'm going to push back at that. I'm going to say, they've gotten this wrong before. Nobody really knows going forward, but I'm going to look at the other people. Who are the other people I'm going to look at? And if you've been watching these data updates, you should know the name of the C19 Pro model put out by Youyang and colleagues is what I'm going to turn to, because it continues to deliver. In July, he said deaths and cases are going to start going up. I paid attention. A week or so later, they did. He also said deaths are going to peak in early August. A week or so before it happened. When it happened, I noticed. And so those are 2 things that he's gotten really right, more right than the other models. And that's why I'm going to stick with him for now. Now, needless to say, he doesn't have any special corner on the truth. What he does is he handles data. And he looks at the data indicators and he tries to say, without adding in my presuppositions, what do I think will happen? So this is, and notice that his forecast, he has a tweet that just came out, that his forecasts have actually improved slightly, but notice that he's not going, if you can see, it's really small at the bottom of the screen, but he's only predicting through November 1, because he knows as well as anyone else that respiratory viruses peak in the winter. And he's uncomfortable with taking his current data and applying it to the winter situation. That said, he's been reliable before, so I definitely want to trust this at least through November. IHME and Youyang's models are diverging, and we're going to tell really soon who's right in a couple of weeks. So let's sit back and watch and get our popcorn. I actually have popcorn right here, so I've got the popcorn. Let's sit back and watch to see who ends up being right, because these two lines are diverging. IHME is shown on purple here, and GU's projections are shown in blue. Notice that they stop relatively early. But we should be able to tell pretty soon, by mid-October, whether we're following GU's line or whether we're following the IHME line, even with the bounds of uncertainty that IHME does. And the biggest problem is that IHME is taking this line and extending it way over to the end of the year, to the point where we don't know. And I want to be skeptical of that. This is GU's most likely guess. He wants to guess that there will be about 250,000 deaths. He guesses that there will probably be about 200,000 by November, and 250,000 in the says 50,000 in the last 2 months. That comes out to about 25,000 deaths per month, and that's less than half what IHME is predicting. So, the main thing I want to say, IHME is trying to help us make decisions. Great, but there are other people who are trying to help us too. So let's listen to those, especially when IHME is far away from the other forecasters. Now, the other forecasters are not going out on a limb yet, and maybe they should. But I'm skeptical. And as a scientist, I think that that's where I should be. So realize that the weakness of Youyang-Gu's model is it's trained on the current data. If the situation stays largely the same, it's really good at picking up and predicting what's going to happen. But if there's something that is outside what we've seen before, and we haven't seen November before, if something happens in November with our social behavior and with the way the virus transmits that will increase transmission, then Youyang-Gu's model will not pick it up. And it is important to say that the coronaviruses do tend to be seasonal. It's important to say, on the other hand, SARS-1 was not seasonal, although that might have been because we stamped it out. So the common colds are definitely seasonal, as everyone knows. The coronaviruses that cause the common cold, the 4 strains are shown right here. 3 of the 4 strains show a strong seasonality in which they peak in December. One of them actually shows a March peak, which is kind of interesting, but let's put that aside. Needless to say, the one thing I see when I look at this, those numbers, those lines are really low on month 10 and month 9. That implies that at least if they follow this same pattern, if we're worried about them doing this, it looks like month 9 and month 10 are actually going to be okay. And month 11, depending on how the virus behaves, is going to be a little worse. We can start to look for signs of it. And this is one of the reasons, again, why GU has widened his uncertainties in response for November 1st predictions, and why he very wisely won't predict beyond November 1st, although eventually I expect him to extend a little bit. So this is another reason why the IHME data looks wrong to me, because according to this seasonality data, you should only see it start to go up in November, but IHME has it going up way before that. We'll be able to tell. So let's keep an eye on it. That's part 1. Now I want to move local for part 2.